In a recent observational study conducted by researchers in Sweden using the data from the Sweetheart Registry suggests that long-term use of beta blockers might not actually improve clinical outcomes for patients who are free from heart failure or left ventricular systolic dysfunction after experiencing a heart attack. So, should we actually continue to prescribe beta blockers post-MI as part of their cardiac cocktail? Hi, I'm Herb, the heart pharmacist, and on this channel, I review the most up-to-date and evidence-based information on heart medications and supplements to help people choose wisely to help people live longer and healthier lives. During a median follow-up period of 4.5 years, the study found no significant difference in the risk of a combination of outcomes, including all-cause mortality, recurrent heart attacks, unscheduled revascularization procedures, or heart failure hospitalizations between patients who were taking beta blockers and those who were not 1 year after their heart attack. The data also did not show any difference in the individual components of the combined outcome, or in terms of cardiovascular mortality or stroke. Traditionally, beta blockers have been recommended as a standard treatment after a heart attack, regardless of the presence of heart failure. However, the guidelines were based on trials conducted at a time when heart attack treatments were different. Nowadays, most patients receive revascularization with percutaneous coronary intervention, or PCI, and multiple evidence-based medications for secondary prevention, leading to reduced occurrence of things like post-heart attack heart failure. Several observational studies have previously investigated on the effectiveness of beta blockers alongside contemporary heart attack treatments, yielding mixed results. For example, the Obtain registry suggested a lower mortality risk with beta blockers after an acute heart attack, while other studies and registries like the REACH and the Clarified registries did not find any significant difference in outcomes. Given these varying results, the senior author of the study, Dr. Batra, emphasized the need to reevaluate whether prescribing beta blockers to all heart attack patients is necessary and is calling for clinical trials to determine whether prescribing beta blockers to all patients who've had a heart attack is actually necessary. Beta blockers are not benign and are fraught with issues. They make people feel lousy, they contribute to asthma attacks, affect your ability to physically exert yourself, etc. And the thought of having an extra pill on a long-term basis is a concern for some people. Obviously, observational studies like these have their limitations, and large randomized clinical trials are needed to conclusively determine the benefits and risks associated with long-term beta blockers used in this setting. Overall, the study raises questions about the current guidelines recommending beta blockers in all patients who have experienced a heart attack without contraindications. Until more evidence from clinical trials is available, the decision to prescribe beta blockers should be individualized, in my opinion, based on patient-specific factors, and this is something I try to advocate for amongst the cardiologists that I work with. The need for long-term beta blocker use in lower risk patients for heart failure who have preserved LV function and no overt heart failure remains uncertain, and ongoing trials including ABYSS, BATAMI, DAMBLOCK, REBOOT, Reduced Sweetheart are trials that I'm keeping my eyes peeled for hopefully helping us answer this question. Now, whether you're a patient, a doctor, a pharmacist, nurse, or student, considering giving this video a thumbs up or sharing it with someone you know who may benefit from videos like these, or even subscribe. It'll help videos like these regarding judicious use of heart medications get out to more people. I think I have like 20 subscribers right now, which is amazing, and I thank each and every one of you for helping this channel grow, and I will continue to put out good content for you all. Again, thank you all for tuning in, and we'll see you in the next one. Follow for more and say no to drugs.